Good evening, everyone. Myself, Dr. Sneha Bhatia, MPT Orthopedics and Sports Rehabilitation. I am in charge principal at late Srimati S. G. Patel Institute of Physiotherapy. So, this lecture I will be talking on functional assessment of ankle joint. So, first of all, we have to check the range of motion of the ankle joint. The range of motion of the ankle joint we have to check precisely dorsiflexion and plantar flexion. And for the movements of the subtalar joint, we have to check inversion and eversion. We have to check the balance. To check the balance, there is Romberg's test. There are various scales available. So using the scales, we have to check the balance of the patient. Next, we have to check for the proprioception. Proprioception is all about joint awareness. So we have to check the proprioception of the patient. So the functional range of motion for the locomotion is, for descending stairs, full dorsiflexion, that is 20 degree is required. And for walking, we require dorsiflexion of 10 degrees and plantar flexion of 20 to 25 degrees. Coming to the chronic ankle instability, there are two types of insufficiencies. One is mechanical insufficiency and the second one is functional insufficiency. In mechanical insufficiency, we can have pathological laxity, arthrokinematic restriction. Arthrokinematic restriction means if we are having fracture or any other pathology and due to that there is positional fault at the bone level, then it will result in arthrokinematic restriction. Degenerative changes like osteoarthritis, synovial changes, all this will lead to mechanical insufficiency. In case of your functional insufficiency, we can have impaired proprioception. If the joint position sense is not intact, then we can have impaired proprioception. If there is impaired neuromuscular control, then also it will result in functional insufficiency. If there is strength deficit, for example, the strength of dorsiflexor muscles and plantar flexor muscles, if these muscles are weak, it will result in strength deficit, which will in turn lead to functional insufficiency. Impaired postural control, if postural control is impaired, then again it will lead to functional insufficiency. So mechanical insufficiency plus functional insufficiency, that will lead to recurrent ankle sprain. So if we see, majority of the patient who are having ankle sprain, they will have recurrent ankle sprains, which will lead to CAI. CAI is chronic ankle instability. There is something called as functional ankle instability. So individuals who experience residual ankle sprain symptoms have a condition known as functional ankle instability, and giving way is common among individuals who have suffered an ankle sprain. Clinicians typically assesses FAI by obtaining a history of the frequency of recurrent ankle sprains and giving way sensation occurring with activity. Giving way sensation means the patient will have laxity as well as they will feel that they don't have any control over the joint. So these are the some functional tests for the ankle joint: squatting on the toes, squatting and bouncing at the end of the squat, standing on one foot at a time, standing on toes one foot at a time, going up and down the stairs, walking on the toes, running straight ahead, running, twisting and cutting, jumping and going into a full squat position. You can ask your patient to do all this functional movement and then check for any impairment. These are the tests. Lift toes and forefoot off the ground, so that will check your dorsiflexion movement. Second test is lift heels off the ground, that will check your plantar flexion movement. Lift lateral aspect of the foot off the ground, that will check the ankle eversion. Lift medial aspect of the foot off the ground, that will check the ankle inversion. Lift toes off ground, that will check toe extension movement. Pick up small objects from the toes, that will check toe flexion. So there is something called as ankle joint functional assessment tool, that is called as AJFAT. So there are some 12 questions which we asked according to this assessment tool. The first question is, how would you describe the level of pain you experience in your ankle? So the gradings are from 0 to 4. 0 means much more pain, 1 means slightly more pain, 2 means equal in the amount to the other ankle, 3 means slightly less than the other ankle, and 4 means much less than the other ankle. So the second question we ask is, how would you describe any swelling of your ankle? Third question is, how would you describe the ability of your ankle when walking on uneven surfaces? Fourth question is, how would you describe the overall feeling of stability of your ankle? For example, the patient is having laxity and he is having giving way sensation. Then the patient will complain that I feel that my ankle is buckling while I walk. Question number 5 is, how would you describe the overall feeling of strength of your ankle joint? So suppose the patient is feeling weak at the ankle joint, they can rate accordingly. Next is, how would you describe your ankle's ability when you descend the stairs? Next is, how would you describe your ankle's ability when you jog? How would you describe your ankle's ability to cut or change direction when running? How would you describe your the overall activity level of your ankle? Which statement base describes your ability to sense your ankle beginning to roll over? So these are the question, and you can ask your patient to rate it from 0 to 4. 11th question is, compared with the other side of the ankle, which statement base describes your ability to respond to your ankle beginning to roll over? And the 12th question is, following a typical incident of your ankle rolling, which statement base describes the time required to return to activity? So for example, a patient is having difficulty in performing some activity. So then after how much time they are feeling normal about that particular activity? So the references of this slide, I have taken the content from Orthopedic Physical Assessment Maggie and from another 2 articles. So thank you for watching my video. I hope you liked the video. If you have liked the video, then please subscribe my channel, and you can also give comment in the comment section below. So since corona, we are fighting against the corona COVID-19 disease, we have to do these 5 things. First is hands, wash them often. Second is elbow, cough into it. Third is face, don't touch it. Fourth is feet, stay more than 1 meter apart. And fifth is, feel sick, then stay at home. Thank you for watching my video.